CPR, or cardiopulmonary resuscitation, is an emergency procedure used to restore blood circulation and oxygenation in the body when a person's breathing or heartbeat stops. Below is a concise guide based on standard guidelines, such as those from the American Heart Association. Steps for adult CPR. Check the scene and person. Ensure the area is safe. Check for responsiveness by tapping and shouting, "Are you okay?" If unresponsive, call for help or ask someone to call emergency services, such as 911 in the US. Call for help. If alone, call emergency services before starting CPR or use a speakerphone if possible. If someone else is present, instruct them to call and get an AED or automated external defibrillator if available. Check breathing. Look for normal breathing for no more than 10 seconds. If no breathing or only gasping, begin CPR. Start chest compressions. Place the heel of one hand on the center of the chest, on the lower half of the sternum. Place the other hand on top, interlocking fingers. Press down hard and fast. Depth, about 2 to 2.4 inches or 5 to 6 centimeters. Rate 100 to 120 compressions per minute. Think of the beat of "stayin' alive." Allow the chest to fully recoil between compressions. Give rescue breaths if trained. After 30 compressions, open the airway by tilting the head back and lifting the chin. Pinch the nose, give 2 breaths, each lasting about 1 second, watching for the chest to rise. If untrained or uncomfortable, continue with compression-only CPR. Continue CPR. Repeat cycles of 30 compressions and 2 breaths or just compressions until the person shows signs of life, such as breathing. An AED arrives and is ready to use. Emergency personnel take over. You are too exhausted to continue. Use an AED if available. Turn on the AED and follow its voice prompts. Attach pads to the person's bare chest as shown on the device. Ensure no one is touching the person during shock delivery. Keynotes for children 1 to 8 years. Use 1 or 2 hands for compressions, about 2 inches deep. Adjust breath volume. For infants less than 1 year, use 2 fingers for compressions, about 1.5 inches deep. Be gentle with breaths. Training. Formal CPR training is highly recommended for proper technique and confidence. Safety. Do not perform CPR if you're untrained and unsure. Call emergency services immediately. For the latest guidelines or specific scenarios, check with organizations like the American Heart Association or Red Cross. If you have a specific question about CPR, such as for a certain age group or situation, let me know.